We will talk today about assisted reproductive technologies. Infertility is a source of social and psychological suffering for both men and women and can place great pressure on the relationship within the couple. 1 in 6 couples of any society remains infertile, and 10% of them need help of assisted reproductive technology. So ART refers to all technology where gametes are manipulated outside the body. Definition of infertility: couples that have been unable to conceive after 12 months of regular sexual intercourse without birth control are infertile. Women who have repeated miscarriages are also said to be infertile. What is necessary in order for a woman to get pregnant? The ovulation, transportation through fallopian tube, fertilization, and implantation. What are risk factors for infertility? Advanced maternal age, the stress, poor diet, smoking, alcohol, sexually transmitted diseases, obesity, underweight women, caffeine intake, and too much exercise. A woman's fertility naturally starts to decline in her late 20s. After age 35, a woman's fertility decreases rapidly. A woman is born with all the eggs she will have, and with time, the supply diminishes. The remaining eggs also age along with the rest of the body. Pelvic inflammatory disease, ovulation disorders, elevated prolactin level, polycystic ovarian syndrome, early menopause, benign uterine fibroids, and pelvic adhesions. Inflammatory disease, uterine physical obstructions include endometriosis, pelvic inflammatory disease, uterine fibroids, pelvic adhesions, and ovarian failure. Ovarian failure may be a consequence of medical treatments or the complete failure of the ovaries to develop or contain ova, as we can observe in Turner syndrome. Also, it may be as a result of chemotherapy and radiotherapy for cancer. Hormonal obstructions include ovulation disorders, elevated prolactin level, polycystic ovarian syndrome, and early menopause. One of the causes is polycystic ovarian syndrome. And the androgens are produced in large amount, so-called hyperandrogenia, and it causes an irregular or no menstrual cycle. Other causes are medications, thyroid problems, mostly hypothyroid, cancers and its treatment, and other medical conditions which are associated with delayed puberty or amenorrhea, sickle cell disease, or HIV, AIDS, kidney disease, and diabetes mellitus. The fertilization problems may be associated with anti-sperm antibodies or oocyte membrane proteins. Talking about the membrane proteins, I would like to mention receptin. It's oocyte membrane protein, which is responsible for binding sperm with the egg. If this protein is not receptive or present, fertilization cannot occur. What is hard egg? It's the thick, hard shell around the egg, the zona pellucida. And at this time, it's difficult for sperm to penetrate even under the best of circumstances. One of the methods is intrauterine insemination. The goal is to increase the number of sperm that reach the fallopian tubes and subsequently increase the chance of fertilization. This method allows to overcome some of the barriers responsible for preventing the migration of spermatozoa to the distal part of the fallopian tube. For example, the acidity of the vaginal contents, the characteristics of cervical mucus, cervical canal, etc. Thus allows to increase by 25% the number of spermatozoa in the distal part of the fallopian tube. In which cases we use this intrauterine insemination? The indication for men are mild pathospermia, hypospadias, ejaculatory and erectile dysfunction, or retrograde ejaculation, immunological factor, antispermal antigens, and agglutination of spermatozoa, high sperm viscosity, and azoospermia. In this case, the intrauterine insemination is performed with donor sperm. Indications for women include unavailability of coitus when there are anatomical defects of the reproductive tract or vaginismus, cervical factor, and psychological sexual dysfunction. In which cases intrauterine insemination is not recommended. Women who have severe disease of the fallopian tubes, women with moderate to severe endometriosis, and women with a history of pelvic infection. What is in vitro fertilization? It is assisted reproductive technology, commonly referred to as IVF. IVF is the process of fertilization by extracting the eggs from ovaries, retrieving a sperm sample, and then manually combining an egg and sperm in laboratory dish. The embryo or embryos is then transferred to the uterus. Other forms of assisted reproductive technologies are gift and zift, which means gametes interfallopian transfer and zygote interfallopian transfer. Indications for IVF are blocked or damaged fallopian tubes, male factor infertility, including decreased sperm count or sperm motility, women with ovulation disorders, premature ovarian failure, uterine fibroids, individuals with a genetic disorder, unexplained infertility, endometriosis, bilateral salpingectomy, idiopathic and immunological infertility. So, in vitro fertilization, IVF, is a process by which an egg is fertilized by sperm outside the body, which means in vitro, evolved as a major treatment protocol for infertility. The term in vitro comes from the Latin inglas, is used as early biological experiments involving cultivation of tissues outside the living organism were carried out in glass containers such as beakers, test tubes, or petri dishes. A colloquial term for babies conceived as the result of IVF is test tube babies. The history of IVF begins more than a century ago. In 1890, the very first in vitro manipulation of embryos was performed by Walter Hibb when he transferred in vivo fertilized egg from one female rabbit to another. Later, in 1959, Chang successfully conducted IVF in rabbits. In 1969, The journal Nature published a paper authored by Edwards and Stetto, Early Stage of Fertilization in Vitro of Human Oocytes Matured in Vitro. The announcement of birth of Louise Brown in July 1978 was not the beginning of the end of in vitro fertilization, IVF, but an important milestone along the way to what is now an important and internationally recognized treatment option for some infertile couples. The birth of Louise Brown occurs exactly more than 100 years after the first attempts of in vitro fertilization of mammalian eggs, which was made by the embryologist Scheck in 1878. Indications of IVF. IVF is most clearly indicated when infertility results from one or more causes, having no other effective treatment. Tubal disease. In women with blocked fallopian tubes, IVF is largely replaced surgery as the treatment of choice. Endometriosis. Patients with endometriosis often have tubal involvement and ovarian cysts endometriomas. Ovulatory dysfunction in patients with PCOS and other ovulatory problems. Age-related infertility. In normal reproductive life, a woman's ovarian function is diminished with age, as we said before. In many cases, this reduced function can be overcome through the use of IVF. Male factor infertility. This includes azoospermia, oligozoospermia, astenozoospermia, and anti-sperm antibodies. Pre-implantation genetic testing. Genetic testing on pre-implantation embryos may be indicated for patients who are at risk for genetic disorders such as cystic fibrosis or thalassemia. The IVF cycle includes several steps. The first one is initial evaluation. Then the suppression of natural hormonal cycle occurs. Ovarian stimulation, collection of oocytes, then collection of sperms, in vitro fertilization of oocytes, and eventually embryo transfer. What means initial evaluation? In initial evaluation, a blood test, then seminal fluid examination, hysterosalpingogram, and transvaginal ultrasound are obtained. What suppression of natural hormonal cycle means? That means that the spontaneous ovulation is prevented. In an IVF cycle, it's important that natural ovulation should not occur. If the eggs leave the ovary, it's impossible to retrieve them. Drugs which are used for this are suppression of natural hormonal cycle are oral contraceptive pills, each day starting from the first or second or third day of the menstrual cycle for approximately 2 to 4 weeks. The next medication is Lupron or leuprolide acetate. It's gonadotropin-releasing hormone agonist. It suppresses LH surge and prevents eggs from being released before they are mature for egg retrieval. Subcutaneous injections every morning. Next medication is nafarelin. It's gonadotropin-releasing hormone agonist also. It's used 3 times a day in form of nasal spray. Ganirelix acetate injection, cetrotide. It's gonadotropin-releasing hormone antagonist. Then the process of ovarian stimulation comes. Ovarian stimulation is used to produce multiple mature follicles rather than the single egg normally developed each month. Regular monitoring by ultrasound scan is done. Different medications are used for ovarian stimulation. These are human menopausal gonadotropin, follicle-stimulating hormone, luteinizing hormone, which is used in conjunction with FSH, clomiphene citrate. And also, there are medications which are used to prevent premature ovulation. For this reason, we use gonadotropin-releasing hormone agonists and antagonists. Generally, 8 to 14 days of stimulation is required. On the left picture, you can see the ovarian follicle stimulated by ovulation medications, which are seen on ultrasound. As you can see, there are several mature follicles. But there are some possible side effects of ovarian stimulation: discomfort, bruising or swelling at injection site, rash, allergic sensitivity, headache, mood swing, abdominal discomfort and bloating, chance of multiple pregnancies, and which the most severe ovarian hyperstimulation syndrome. Ovarian stimulation can result in enlargement of the ovaries with leakage of fluid in the abdominal cavity. Most cases are mild, but a small proportion are severe and fatal. Treatment of this condition depends on the severity of the hyperstimulation. Mild cases can be treated conservatively. If moderate to severe hyperstimulation develops, the IVF process should be postponed since establishment of pregnancy can lengthen the recovery time or contribute to a more severe course. How oocytes are collected. The oocyte maturation is performed generally by injection of human chorionic gonadotropin (HCG). It's commonly is called trigger shot. The egg retrieval is performed at a time usually between 34 and 36 hours after injection of the HCG. The egg retrieval is usually accomplished by transvaginal ultrasound aspiration. It's done under short general anesthesia and is 20 to 30 minutes procedure. In some circumstances, one or both ovaries may not be accessible for transvaginal ultrasound. Then laparoscopy may be used to detect the eggs. This picture you can see the collection of oocytes. Usually around 10-15 oocytes are aspirated. The eggs are prepared and extracted from the surrounding cells. After the eggs are retrieved, they are examined in the laboratory for maturity and quality. Mature eggs are placed in an IVF culture medium and transferred to an incubator to await fertilization by the sperms. The next, collection of sperms comes. Shortly before or after the oocyte collection, the male partner will be asked to give a sperm sample. Sexual abstinence of 3 or 4 days should be exercised. Collected about 60-90 minutes prior to fertilization. Liquefied, centrifuged, suspended in culture medium, and incubated for 30-60 minutes at 37 degrees by Celsius. The most active sperms are located in the surface of the medium. Sperm may be obtained from the testicle, epididymis, or vas deferens from men whose semen is void of sperm either due to an obstruction or lack of production. Fertilization is started by adding 10-50,000 material sperms to about 100 microliter to 1 milliliter culture medium in which the oocyte is being incubated. Intracytoplasmatic sperm injection is indicated in cases where semen fluid does not contain any sperm. Intracytoplasmatic sperm injection, or ICSI, is injection of single mature immobilized normal spermatozoa into the cytoplasm of mature metaphase 2 oocyte is known as intracytoplasmatic sperm injection. Since the introduction of ICSI, it has revolutionized the treatment of male factor infertility, and excellent pregnancy and implantation rates achieved in couples for whom there were no treatment option except donation or adoption. Fertilization check is performed the next day, approximately 18 hours after sperm injection or insemination of the eggs. Usually 65% to 75% of mature eggs will fertilize after insemination. They are cultured in special incubators to support division and development. If the couple has a history of certain genetic disease and the gene that is causing the problem is identified, a pre-implantation genetic diagnosis may be done. This picture, you can see development of embryo starting from the first day, 2-cell stage, then second day, 4th stage, third day, 8th cell stage, and eventually day 5 when the blastocyst containing 200-300 cells. When and how embryo transfer happens. Embryo transfer may be performed on day 2, 3, or 5 post-fertilization. One or more embryos suspended in a drop of culture medium are drawn into the transfer catheter. The tip of the transfer catheter is gently guided through the cervix and placed in the fluid containing the embryos into the uterine cavity. This question, how many embryos are transferred? Really, it depends on age, related to age and embryo quality. If the age is less than 35, we can transfer 2 embryos. 35, 37, between 2 and 3 embryos. If the age is higher, advanced age, 38, 40, we can transfer 3-4 embryos. And if the age is more than 40 years, up to 5 embryos can be transferred for best results. The percentage of success depends on several factors. For example, a woman's age. If she is less than 35 years old, percentage of success is 41-43%. Between 35 to 37 years old, success is 33-35%. If she is 38-40 years old, success is 23-27%. And after 41 years old, the success is minimum 13-18%. There are other statistics. Repetition of 4 trials, success rate 70-80%. Repetition of after 3 trials, success rate is 60-65%. If 4 embryos are transferred, success becomes 40%. If 3 embryos, 35%. If 2 embryos, 25%. And if 1 embryo, 17% success rate. Other factors include increasing the number of embryos transferred, the success rate increases. Risk of multiple pregnancies increases and miscarriage increases. Quality of the eggs and sperm, number and quality of embryos. There are different variations of IVF. One of them is gamete into fallopian transfer gift. It's similar to IVF, but the gametes are transferred to the fallopian tubes rather than uterus, and fertilization takes place in the tubes rather than in the lab. The next form is zygote intrafallopian transfer, so-called SIFT. This technique differs from gift in that fertilization takes place in the lab rather than the fallopian tube, but is similar in that the fertilized egg is transferred to the tube rather than the uterus. The pose comprises less than 1% of IVF procedures performed worldwide. Well, Fullerton mentioned the intracytoplasmatic sperm injection. It's mostly commonly used to overcome male infertility problems. ICSI is a highly specialized variant of IVF when fertilization is expected after the introduction of one sperm directly into the cytoplasm of the oocyte. ICSI is carried out with the help of an inverted microscope equipped with the micro manipulators using special micro instruments. And azoospermia, spermatozoa, can be obtained from epididymis or testicles through the puncture or biopsy. The procedure of ICSI prevents entering to the oocyte more than one spermatozoa. This method also allows selection of the best spermatozoa. Cultivation and transfer of embryos is also carried out as in IVF. This is process of ICSI. There is process which is called assisted hatching. What is that? Assisted hatching is laboratory micromanipulation technique carried out before the embryos are placed into the uterus that helps the embryo to hatch from the zona pellucidum. It promotes the onset of pregnancy due to an artificial gap in the zona pellucidum immediately before the transfer of the embryo into the uterine cavity. Assisted hatching can be carried out by mechanical, chemical method, or by means of a special laser installation. Actually, that means cutting of this zona pellucidum. One of the methods is surrogacy. Surrogacy means the transfer of the embryo of genetic parents. Traditional IVF or IVF ICSI procedure is performed into the uterine cavity of another healthy woman. This program must necessarily be accompanied by legal and psychological support. For example, in our country, we do not use surrogacy. Indications for surrogate motherhood are the absence or inferiority of the uterus, several unsuccessful attempts of IVF, the availability of absolute contraindications to pregnancy and to the parturitions, somatic diseases of severe form. In some cases, oocyte donation programs are used. Oocyte donors undergo a procedure of controlled ovarian stimulation, transvaginal puncture of the follicles for oocyte donation, collection, which will be used in the IVF program for the onset of pregnancy of the recipient female. The donor's egg are fertilized with the sperm of the recipient's husband. The obtained embryos are transferred to the uterus of the recipient. First, she will become a biological mother. And even without being genetically related to the child, the patient nurtures her fetus in her body, and at the same time, she takes for her or his growth and development absolutely everything that is genetically predetermined. Indications for oocyte donation are premature menopause up to 40 years, genetic diseases of the recipient, syndrome of post-castration, depletion of the ovarian reserve, gonadal dysgenesis, or the oocyte donation program, the recipient must have uterus. Besides, there is option of cryopreservation and transfer of embryo. The obtained embryos can be saved for the future by cryopreservation and further storage. Temperature is minus 196 degrees Celsius. Hormone therapy is used to prepare the uterus for the embryo transfer. Transfer to the uterus only on condition that it is viable. Gametes also can be cryopreserved. Oocytes as well as spermatozoa, testicular tissue biopsy, or an appendage for storage and their further use in ART programs. Thank you for your attention.